Welcome to the office.
Welcome back, Flo.
Thank you.
Good to see you.
Good to see you as well.
How did you do with our first adjustment?
At first, like going home, I felt a little like lightheaded.
Okay.
In the neck area, warmth and it's tender. But in my back, lower back, there's some pain, but and a couple of spasms throughout the day. But overall, like today, feel much better. Like a huge decrease in overall pain that I usually have.
Now you have a 3.5 hour drive back?
Yeah.
We don't normally recommend people to drive back, but it is what it is. Okay, and this morning when you woke up, how was the movement? How was the stiffness? How was the pain?
It was a lot better. Yesterday, there was a lot more soreness and stiffness.
Absolutely.
Yeah, but
sure.
Today, a whole lot. It's less. It's decreased by a lot.
10%, 20%?
It's decreased, or I would say by like 70%.
Oh wow.
Yeah.
Okay. All right. What else?
And then I did my 10,000 steps. I got those in. The main pain I felt was just in the right ankle. Again, a couple of aches here and there in my lower back. the back pain and the ankle pain.
Yeah, okay. So you were able to get your steps in.
Yeah.
Ankle was sore at the end, or pain?
Both.
Okay.
I'd say both.
All right.
And then I used to have this like sharp burning pain through my ankle. And when I would touch.
Pointing to your thigh though.
Oh, my thigh. My thigh. And when I would push on it, it would hurt. But now I don't feel it anymore.
Okay.
Yeah.
So we got a few good changes. Not
yeah.
bad for one adjustment.
Yeah.
You ready for round two?
I'm ready.
Let's do it. All right. So we did her critical atlas and sacrum on the first visit. Let's see what we got today. And I got my new associate over here that will be demonstrating some stuff on down the road as we start the next part of the journey in this office. Today, let's figure out where we're at. All right. And I need you to put that hair tie up top, please, for me, if you don't mind. You can butt it, it's even better. So what I'm going to show, while she's doing that, what I'm going to use this for a lot of things in terms of setups, showing extremity adjustments, but also TMJ, because TMJ, everyone wants to know about TMJ, and nasal bone versus nasal septum, and all the different extremity adjustments, the setups, the back of the spine, contact points, and I think we can also set him up. But we don't have a name for him yet, or her. So, guys, let's suggest some names, all right? You have any suggestions of names? We don't have a name. This is my newborn associate. So, we'll think about some names. All right, let's see, starting at the base of the neck. Nice. Today I got only 3 points. Left side. You came with Mom?
She's in the car.
You need that carpool buddy, huh? She's sleeping?
No, she's on her tablet.
Okay. All right, now we got, it looked like a break. There it is, T189, left side, 10 points. And that area is part of the adrenal system, which will also help with reducing inflammation. But if you can see already, there's a lot of your inflammation has come down. Still there, but less. Wow, 5 points down low. All right, let's see what we got going on here. Back slowly towards me. That's 5. That's S1. That's S2. That's S3. That's S4. Not too bad there. Different, yeah?
Right there.
We're going to continue on S3. The movement is better, but it's still there. 1, 2, 4, 5, 6, 7, 8, 9. Let's check static palpation. And so we have something to compare, and you can see there was a lot more bogginess here that first visit. 1, 2, 3, 4, 5, 6, 7, 8, Tender there.
Mm-hmm.
How about that one? More
Probably
here.
more right there.
Not there as much. Number 9.
Yeah.
9. We're going to continue on S3. And let's check up top. Sit back for me there, please. And the glasses up. And let's do motion palpation. 6, 5, 4, 3. Bend left, bend right. Tender in there, yeah?
Mm-hmm.
But we're still up top. And we said we talked about that reverse curve, remember? So, let's see what we got today. We're going to continue on S3. We're going to work on T9 today. I think 5, 4, 3, 2, 1, 10, 9. T9 is a PRS. And let's look up top. And then that goes, nope, we're going to wait on T9. We're going to continue on the upper cervical, and we're going to continue on that atlas. Okay? You ready?
Ready.
C2. Chin back. There we go. C2. Nice and easy there, okay? Good. You got to let that drop. Nice. Wow. Nice deeper sound today. Relax it back for me. C1, right side. Let's go over here, face down, please. C2PL, sacrum, S3. S3, the famous sacrum. Slightly on that left side. So I can't really justify that T9. Slide up, it's probably going to clear up anyway. Slide forward, up, because it's wedged opposite the sacrum and the upper cervical, so it's probably a compensation. Even though it was tender. We'll see at the end what happens. Relax the shoulders down, please. Wow. Feet together. There it is. That's the home run. Nice. You okay?
Okay.
My hand is here.
Thank you.
That's what we got. All right. And let's walk about 2 times, please. And then we're going to recheck. Awesome. Have a seat. Let's see if my suspicions were correct. Actually, they weren't a suspicion, it was the analysis. Neck is clear. Let's see what happened over here. 9 is clear. Maybe a tiny bit. Nope. More walking you do, the better that's going to feel, okay? I don't want to chase it. Poquito más. Let's do right side down. We're going to do more of your tailbone, right side down. So, rotated sacrum versus the iron ilium. And we're doing the right side. Sorry, we're doing the left side, but it's the right ankle. Slide forward, please. Bottom butt forward. There you go. Bottom leg straight. Now, let me do the work, please. Okay, I got you the whole way. Hold your wrist there. Good. Now, I'm going to hold. Let's hold here. You good?
Mm-hmm.
Nice and easy there. Let it roll. Gotcha. Nice. Come up slowly. Let's walk it off. Okay, let's walk it off. Do-do-do-do. Do-do-do-do. And let me just open the back of the lower gown, just so we can see the dimples. Go ahead and walk for us. Little different, little more different. Pretty cool.
Everything just, it's like a lot smoother, no more aches and pains and little pulls or
Good.
here or there.
And you know, as you're going through this, right, you're gonna have, we said, those good and bad days as the things start to balance out. Let's go on your back over here, please, and let's work on that ankle. And now we need to go a little deeper with that ankle today, okay?
Okay.
This is kind of cool because we're going to start to look at all the ligaments and bones here. And what we're doing here is this. So we're going to be working on her right ankle, and she has an AS talus. And we're going to check which tilt is there. And you can see you have the ligaments, you have muscles, all the stuff that goes over it. And what I always explain is think of the joints as the pulleys, and the ligaments, tendons, muscles, those are what? Those are the cables. And if the pulley is out of alignment, those cables don't work right. And if the pulley is out of alignment, let's say, we get adaptive shortening of the ligaments. And so we have to work that scar tissue out. Otherwise, nothing really holds. We can start popping stuff, but we have to also work the soft tissue structures. And if we look here, we feel that on the medial side versus they're both tender. So let's do dorsiflexion test. Slide down so your ankles are hanging right off the edge, please. Cool. And dorsiflex, let me do the work, passive range of motion. So thumb and finger on the dome of the talus. Right there, medial side, lateral side. More tender on the medial side. Okay? And you can see it's kind of, let's compare just to see. There we go. I mean, they're both kind of off. But we'll start with this one today, okay?
Okay.
And we're going to work the periarticular swelling. Periarticular swelling is the swelling that surrounds the joint. Inflammation. Swelling is the same as inflammation when I'm saying it, okay? And why does the body, we always get inflammation with injury. Why? It's the body's protective mechanism, right? And it's as much as you can handle, Flora, okay? You want to use some pillow? You want to bring the pillow towards you a little bit? There you go. And as you can see here, as we're working it, dorsiflex. Now this, right there. Yeah. You okay? You can deal with it?
Yeah.
Okay. I may need to call Shasha for backup. Shasha! 5, 4, 3. I need some backup, yo. Shasha!
Hi.
I need some backup, yo. 4, 3, 2. Grab me the tissue box, please. Right up top. Thanks. And now passive range of motion. 5, 4, 3, 2. There it is. Okay, that's fine. Thank you. And you're gonna hold there. You got her?
Mm-hmm.
Nice and easy there. Relax it. Let her go. I just want you to lift her, okay? When I say so. We're gonna lift. When I say so. Especially trying to be a chiropractor too soon. Not yet. There, we're gonna scoop it. Okay. Lift. That's it. Let it go. Yes, there's a lot of scar tissue. You okay there?
Yeah.
4, 3. Breathe through it. Don't hold your breath. Okay, we're gonna have to use the board. It's not gonna go. Not yet. Slide up a little bit. Okay. AS talus. We've got to really get that dorsiflexion. There you go. Posterior fib. That's it. Worst is over, okay? Get up. Well, put your socks back on, please. Good. That's a little brutal, right?
Yeah.
We got a little bit of that to do though. All good. Okay. As soon as you put your socks on, you walk a little bit. I'd like you to sleep in the socks for the next couple of days, okay?
Okay.
It'll help hold the adjustment a little bit better. Okay. Go ahead and walk on it. It's going to be sore.
Yeah, it feels tender.
But the movement should be a little bit easier. Your dimples are moving good. Awesome. Back over here and have a seat. You okay there?
I'm a little shaky, but yeah.
Let's do the buff on the back. Do-do-do-do. I like her honesty. 5, 4, 3. Let's go on your back one more time, please. And keep your socks on. I'm just going to use the machine a little bit. You okay with that?
Yeah, that's fine.
Give that a shot. Go ahead and walk it off one last time. So we're dealing with your sacrum, then we'll get to that pelvis. That's all left-sided. That should feel different now when you're walking. You're going to sleep with your
Socks on.
Next visit, we'll see if we're going to go more on the talus. As you can see in her walk, she does have that pronation and collapsed arch. Before we can even work on that, that talus needs to be stabilized. So one of the things you can start doing, get yourself one of those foam mats. It's called a balance mat. You can get them on Amazon or any of those things. And it's just standing on uneven surface, the balance mat. They're like 16 by 16. They're in blue or gray, whatever color you prefer. And you can start doing some balance work with it. You're going to stand on it and just do balance work, maybe 5 to 10 minutes a day.
Okay.
Okay? You can start on that right away, not a problem. Keep going. The idea is to get motion in there to break up, also break up that scar tissue. Check the hand space, squeeze, squeeze. A little bit on the elbow. Relax the hand, please. Squeeze. Good. Questions for today?
No.
Okay.
Thank you for everything.